talk about falls real quick because it is a problem or a potential injury. If you are having any gait problems, again, whether it's that you're fatigued, whether it's that you're tight, etc., any small change to your gait, again, with your posture or how long your step length is or what your heel does when your foot hits the ground, or that you can't clear your toes as well, whatever it might be, you can't get your leg out all the way straight at the knee. Any of those things increase your risk for falls. Why? Because you have the potential to catch your toes if you can't get that leg bent enough. You have the potential to come down, instead of coming down on your heel, come down on the outside of your foot and twist your ankle. So just like when you're stepping off of a curb or stepping off of that last step, it's the gait leading up to that point. It's how all of the joints, all of the muscles work to getting up to that point that ensures that when you step off of that curb, you land with your foot properly. But again, if your gait is off, even slightly, and certain joints aren't working in tandem with each other, you're going to run the risk of an ankle sprain or falling or whatever it might be, regardless of how old you are, how active you are, etc. When your leg muscles start to fatigue, mostly your hip muscles, your outer hip muscles, and your back hip muscles, your glutes and your abductors, when those muscles start to fatigue, your body's going to start to bend forward just the slightest little bit. So if you've ever been walking for a period of time and you notice that you're starting to lean forward, that's a sign that those hip muscles are starting to get tired, they're fatigued. And as they are tired and fatigued, your body's compensating, and again, that will set you up for the potential for back problems. More importantly, it throws you off your center of gravity. It increases your risk to just trip over your toes. You can be a healthy person with no balance problems, but you can start to trip over your toes more towards the end of a walk because your center of gravity is thrown off a little bit just because of some fatigue in those hip muscles. If you're thinking about starting a walking program, or you're currently doing a walking program, or if you have any problems with walking, whether it's pain, difficulty with walking, I can't walk that long, whatever it might be, that's really where a trained eye comes in. Somebody needs to assess your gait, because we've got to look at specific pieces, what's happening at all of those parts of that chain, and make sure that things get addressed. Because if you've ever heard the saying, no pain, no gain, or a little bit of pain is okay, any of those statements are completely untrue. Pain is your warning sign, difficulty is your warning sign, fatigue is your warning sign that something isn't working properly when you go to do that activity, and in this case, walking. And if that continues, that's what leads to things like Achilles tendonitis and Achilles ruptures, plantar fasciitis or heel pain, knee pain or patellofemoral pain, arthritis in your hip, your knee, your back, disc problems, bursitis, iliotibial band problems. All of those things come from the fact that mechanically your gait is not the way that it should be, and one joint is overworking or overstressing another. You really need to keep in mind that problems can be prevented, and number two, if you're already having problems when you're walking, again, even if it's for 20 feet or for 2 hours, problems can be treated, addressed, and corrected so that your gait is normal. We get you walking, you're able to use it for a healthy lifestyle, keeping yourself happy and active and doing the things you want to do, but being able to do it without pain and or the possibility of future problems developing.